You're recognized.
Thank you, Mr. Chairman. In 2009, the President told the nation that he was not going to be in favor of raising taxes on any family that made under $250,000. Yet looking at the rules of Obamacare, it seems that exactly the opposite will take place. The ban on over-the-counter purchases without a prescription is estimated to raise taxes on families of about $5 billion a year. Can any of would the witnesses each comment on the families that you have experience with that you see are affected by this law? Do they fall in the under $250,000 category, or do they fall above the $250,000 category? Mr. Mel.
Well, as I cited earlier, the most recent data we were able to obtain showed that the average FSA participant earned $55,000 a year. As a result of this provision, if they had an FSA account before the provision took effect, their costs for OTC medicines went up 10 to 35% after the provision took effect.
So that'd be a tax increase.
Certainly a cost increase to the consumer.
Okay. Mr. Fetter, Dr. Fetter.
I can tell you that, my patients, I practice in the great state of Kansas, and I practice in a fairly affluent county, but I guarantee you these patients make far less than $250,000 a year. And we see indigent patients. We see patients that don't have insurance. We give out samples to patients, and we still cannot keep up with the complaints about they can't afford this and they can't afford that. And this is just one more area that I think we can empower and help our patients, and that they don't have to come to the office and spend money to see me to write them a prescription that they can get over the counter.
Thank you. Mr. Taylor.
Thank you. Well, Sjogren's affects 1% of the U.S. population, so surely the majority is going to be earners under $250,000. Affects mostly women, but it does affect people that don't make $250,000. And the patient choice is so important for our patients. But to understand Sjogren's, our patients use between 10 and 17 products daily for their disease, from dry skin lotions all the way up through dry eye options to dry mouth options, et cetera. And so surely that with the prescription issue, it would fill the doctor's offices with having them write prescriptions, and it's causing problems for our rheumatologists, our ophthalmologists to write those prescriptions for our patients.
Ms. Hatcher.
I don't have any specific data, but where we have seen the use of FSA cards, it's throughout all income levels in a community. It's not limited to upper income levels. It's throughout all income levels.
Yes, sir.
Mr. Marchant, it's important to look at not just at the tax effect of this particular provision, but of the entire legislation of which it was a part. As Ms. Jenkins correctly noted, the purpose of this provision is not just to raise revenues for the sake of raising revenues, but to help finance the major expansion of health coverage that was provided by the Affordable Care Act. Indeed, using the figures in the testimony we heard earlier, there are people, the average person benefiting from an FSA will lose perhaps $30 to $40 a year on account of this limitation on over-the-counter spending. However, the Affordable Care Act is also extending health coverage to 33 million Americans who haven't had it, and providing tax credits to which are focused on low and moderate income Americans. So it seems to me, and I can say that as a person with this year for the first time a flexible spending account and who earns less than $250,000 a year, I for one am quite happy to pay an extra $30 a year to help provide health coverage to the less fortunate of our citizens who otherwise wouldn't have it.
So in your view, it was basically a cost shifting of from one group of people to another group of people.
It's not a cost shift. It's a way to raise revenue to pay for a very important program.
That would be what we define as a cost shift. Thank you very much.
Mr. Marchant, may I please add, we have all these new people going to be going on the healthcare rolls, and we won't have time to see them in the physician's offices if our people that do have FSAs are taking up time to get prescriptions. And that's the biggest challenge that we have in the healthcare system is people, there is only 39% on FSAs, but they will be taking up time, important time for other people that could need to get in to see their doctors, which is very important to remember as well.
Thank you, Mr. Tate.